Hello, and thanks for joining me today as we near the end of our cardiovascular system unit. Today we're going to talk about blood vessels and cardiac output. This is a calculation you're going to need to be able to do on an assessment coming up. And so for starters, you're going to be able to describe differences between arteries and veins, anatomical differences. We'll talk about which one is used to take a pulse and explain why. You'll be able to calculate this thing called cardiac output, and then we'll understand what the two numbers of a blood pressure indicate. So when you're given, hey, you're 125 over 78, what does that mean? And how does that affect you? Okay. So for starters, we're talking blood vessels. We have broad scale. We have these things called arteries and things called veins, and between them is capillaries. But you have the way blood flow works is your blood starts in these large arteries, for example, the aorta, and then branches into smaller arteries, which go throughout your body. And when smaller arteries branch, they become these things called arterioles, which are smaller yet, and then those become your capillaries. At the capillary level, we've talked about your oxygen and nutrients exchange, leave the arteries, and end up in the cells, and then waste and CO2 are absorbed from your blood to be exported or expelled from the body. So from your capillaries, capillaries flow into these things called venules, which are small veins. A bunch of venules make a little bit bigger veins, but they're still small comparatively. And then we have these large veins in the end. For example, your vena cava is a very large vein. Okay, so when we talk about blood being forced through the arteries, we're talking about your heartbeat, because remember, arteries take blood away from the heart. And so every time your heart contracts, your ventricles contract, they push this blood through the arteries and force it through your body. And so these are the vessels we use to take a pulse. Is we take a pulse from your arteries because they move blood based on this heartbeat. And because they're taking blood straight from the heart, they have a lot of musculature in their wall. So arteries have a very thick wall to them to prevent holes from tearing open, blood to be lost through a cut or something like that, which wouldn't be good for your body. So comparatively, veins are pretty thin. Little musculature, they don't have to deal with this heartbeat force coming through, and so they can be thinner and more or less a storage place for blood. And then the question is, can you take a pulse in veins? And the answer is really no. I mean, we need your arteries because this heartbeat is what drives blood through them. Whereas veins, blood's pretty slow moving back to the heart. It's more of a consistent push. It's forced through your veins by muscular contraction. So there are muscles surrounding your veins that actually force it through. And then there are these valves to prevent backflow. So for example, the veins in your legs have these valves that prevent blood from staying down in your toes. And once it gets past a certain point, the valve closes and it doesn't open again until more blood is forced through, which continues the process, but it can't go backwards. Okay, so those are arteries and veins. So here's a look. Here's an artery schematic here and a vein schematic here. Notice how much thicker the artery is. Look at that. Look at this wall for the artery, whereas the vein has a much larger gap, a bigger lumen than the artery does, but the wall is not nearly as thick. And so those are your arteries and veins compared in a cross section. Okay, now we're going to calculate cardiac output. Your cardiac output, your body pumps roughly 70 milliliters of blood per heartbeat. So you have 70 milliliters of blood per heartbeat. Then if you were to take a pulse and find your beats per minute, if you know that there is 70 milliliters of blood every heartbeat, so let's say my pulse is 60, I would have 60 heartbeats per 1 minute. And this is going to tell me my cardiac output, which is milliliters of blood per minute, is what we're looking for. So 70 times 60 is going to be 42. Add two zeros is 4,200. And I would have, so my heartbeats are going to cancel. Milliliters of blood per minute is going to be your cardiac output. Okay, and we're going to do this. We'll check our cardiac outputs together and kind of compare them there. So there's a couple places you can take a pulse. One of them is in your carotid artery up in your neck. You can take one with your facial artery, which is a little more difficult, but it can be done. Your brachial is in your arm. Radial is in your wrist. That's the one by your thumb. Your femoral is on the back of your leg. Popliteal is in the back of your knee. And posterior tibial is down in your calf. So you can take your pulse from a number of locations depending on what is most available at the time. Okay, and then to go along with cardiac output, we're going to talk blood pressure as well. So when we talk blood pressure, you get two numbers when you go to the doctor. One of these is called the systole number. This is the bigger number. This is your pressure during ventricular contraction. So when your ventricles contract, what is the pressure of that blood going through your artery? And that's why it's the higher number. More pressure when the ventricles contract than when they didn't contract. So systole is the big number. Diastole is the small number. This is your pressure during ventricular relaxation. And so in this case, we have normal is 120 over 80. So because we're looking at ventricular contraction being high, 120 is going to be your systolic number. 80 is going to be your diastolic number. And then begs the question, what is more important? Is my max pressure more important than my constant pressure? Is my constant pressure more important than my max pressure? And to a certain extent, I mean, you can argue either one. But this one here, I guess we'll look at this. If I have a pressure of 130 over 100 or 140 over 75, which one would you be more concerned with? And it depends on what you're kind of thinking. But this bottom number, this is your ventricular relaxation. This is the low point of your pressure. So if your pressure never gets below this number, this is kind of the baseline for your muscles. So in thinking about that, I would tell you that this number is a little bit more scary because I have a constant 100 I think it's millipascals or millibars of pressure on my body as opposed to only 75. And it only gets up to 130, but this is a constant nagging push on my cells, my vessels that I don't want to rupture. So the diastolic number tends to be more important when we're talking cardiac health. Okay, here are your review questions for this little section. Take your chance, take your time, look through these. Make sure you can answer them. If you have questions on them, don't hesitate to bring those to me when you return. And I look forward to seeing you next time as we begin naming arteries and veins of the body.